How can innovative architectural design improve patient care and clinician well-being? Our next guest, Sharon Woodworth, healthcare sector leader at HED, is leading the charge to create healthcare facilities that optimize efficiency and sustainability. With extensive experience in over 11 million square feet of healthcare facility design, Sharon brings a unique perspective from her background as a former clinician. Deeply concerned about post-COVID staff shortages, she's driven to design environments that alleviate burnout and attract top talent. Altogether, Sharon shares HED's pioneering vision to augment caregivers through responsive, human-centered design solutions. Join us as we explore how HED is reshaping the future of healthcare delivery from outpatient clinics to smart hospitals. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us. Hi, Sharon. A warm welcome to our podcast today.
Thank you. I'm so excited to meet all of your listeners.
Well, given your role as a former clinician and your experience spanning a global range of operational and continuum of care issues from neonatology to senior living, coupled with your deep expertise in designing innovative healthcare centers for efficient patient care, I'm really looking forward to this timely and important conversation. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli in Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and Twitter in order to further the conversations occurring on this podcast. All right, Sharon, it's almost time for our community to learn how you and the HED team are creating impact for your healthcare clients, communities, and the world through responsive, innovative, and sustainable design solutions. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
Wow, that's a great question, Mike. You know what I would tell every listener? I would say put your oxygen mask on first. Unfortunately, as clinicians, we're always thinking of the other person. We're thinking of the patient or we're thinking of a colleague. But if you don't take care of yourself first, we aren't going to be able to take care of our colleagues or our patients. So it's just like when you're on the airplane and you've got a child with you. You put your oxygen mask on first and ask for what your needs are, either in the architectural space or in the operational space and how you work within that healthcare setting.
Sharon, this piece of advice couldn't be more timely. We've seen the actual effects of it being very acute to our clinicians, even to our administrators in healthcare over the past number of years. It really was exposed and laid bare in front of all of us during COVID-19. So your comments and your piece of advice for our community could not be more timely and more needed now than ever. It is absolutely true. We have to take care of ourselves in order to be able to deliver the care to others that many of us into this industry in this first place. Sharon, obviously you started as a clinician. You have that background, very important, especially we're going to talk about how that clinical background that you do have and that you've prided yourself in, how that has impacted what you're doing at HED. But let's talk culturally first. In regards to the built environment, is this also how you talk and engage with your team members? Take care of yourself first because you are designing critically important space for the health and care of others in our country. Is this part of the culture at HED as well?
Yes, in some sense. HED, especially in terms of our healthcare sector, we're primarily known for very complicated problems. So you give me or one of my colleagues a broken watch, tiny little pieces that are made in different parts of the world, and how do you put it back together? So that's what we're primarily after in terms of HED, in terms of our healthcare sector.
That is going to be a very exciting conversation about exactly how you go about doing that and how right now in this time and how much has evolved since the pandemic. You know as well as I do, our world has changed dramatically and is continuing to do so. And I know you helping lead the healthcare sector at HED, answering the call to continue to position yourselves today and tomorrow to continue to improve our industry. We're going to discuss all of that and more after we get back from thanking our community champion sponsor.
Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow.
All right, we're back with Sharon Woodworth, healthcare sector lead at HED. Sharon, thank you so much for joining up for this timely conversation. The world has changed quite a bit over the past number of years, and I can't wait to dive in a bit of how you became the healthcare sector lead at HED, what the team is working on today in this very dynamic space and this very dynamic time for our industry, and of course, where the team is heading and what you're seeing as, on a macro for our industry that we as listeners of the podcast need to be mindful of. And then, of course, how we can be helping you and the team out. But before we go and get into all of that fun topics and exploring everything that I just mentioned, Sharon, give us a little bit of perspective of your journey leading up to becoming the healthcare sector lead at HED. How did this all come together? We mentioned on the front end, you were also a clinician, and here you are now, one of the key designers in the built environment. How did this all come to be? What a fabulous and amazing story. Can't wait to hear more.
So I always tell people I've had 4 careers, and the first career was that very traditional career. What do young girls do when they grow up? They either become a teacher or a nurse. And my 4 careers was both. My first career, I did practice critical care nursing at Texas Children's and Herman Hospital, both in Houston, Texas, for about 15 years, and then neonatology. There was a moment in time when I realized that I had achieved all I could as a nurse in terms of giving back to the patients and the colleagues that I worked with. And I wandered around the world, literally, took a sculpture class and discovered that my sculptor instructor said I should be an architect. I had no idea what that meant. I thought they built bridges, and I thought I'd never walk into a hospital again. But after getting a master's in architecture and working on a bank for my first project, I realized healthcare is so much more rewarding from an architect's standpoint. The setting has an incredible impact on how our healthcare is delivered, not just for the patients and the family, but in particular for the staff. So, Mike, I've been practicing healthcare architecture since the 1990s.
What a fabulous journey. Going around, wandering around the world, taking sculpture, which, by the way, I'm sure many of us tuning in today are very envious of that alone, then heading into the world of architecture. And, there's one area that I really want to highlight, and we're going to talk about who HED is, but also focus in on, because you made a point of it, the built environment is so critically important for not only our clinicians, our administrators, the folks that work in healthcare, but at the end of the day, who we all ultimately serve, the patients themselves. So we're going to go there in just a moment and talk about that a bit and how the built environment, while taking care of the patient for the staff, how do we reduce staff burnout? What does this built environment mean for them? And all of those very, very important topics. But first, before we go there, Sharon, who is HED?
Well, I was describing earlier how Harley Ellis Devereaux, otherwise known as HED, our healthcare sector primarily deals with very complicated projects. And why that is of value to your listeners is anyone, I'm exaggerating to some extent, can take a blank piece of paper, a new site, a fresh site, and build a brand new medical campus, either a hospital or a clinic. But our clients aren't there right now. Our clients are now leaning more heavily on revenue generation, maintaining the value and the investment that they've already had in their buildings, whether they're 10 years old or 50 years old. And that's where HED shines. We take that client's investment in their infrastructure and find ways to convert it, not just to today's delivery of care, but into the future, which we aren't really aware of how that care is going to be delivered. So, in a simple way, the word is flexibility and building in a lot of extra space so that you can, as a healthcare delivery system, change your setting in the future to respond to these new pandemics that we're seeing and to respond to the new equipment and the new medications and the whole evolution in healthcare.
And one important topic around that, Sharon, and you know as well as I do, yes, we went through a massive pandemic, touched pretty much every person on the face of this planet. But within that epidemic, and then even more specifically, or pandemic, the epidemic and the very specific epidemic is around retainment of staff in healthcare and what that has meant to really putting us in some very difficult times today and even heading into tomorrow, if you will. How do we need to think about the design of these facilities, of this infrastructure to retain healthcare providers? Because you know as well as I do, that is now more important than ever. We're seeing mass exodus from MDs, NPs, RNs. I can go down the list, administrative side of the aisle. How important is the built design to help retain our staff that is so critically needed?
Well, I'm going to be very frank with you. As an architect, we're not in a position, even with a well-designed setting, to foster staff retention. That's the truth. But one thing that we can do is offer to the client what I would call a training room or a prototype room. Some might even think of it as a simulation lab. And the reason that I think that is of value is because this turnover is not going to slow down. It's not going to change, and it may even accelerate. So what we see happening is architects, our clients are constantly hiring new employees. Doesn't matter if it's a physician or a nurse, doesn't matter how well skilled they are. They still need, from the architect's perspective, a setting to learn the new processes. It might be a new piece of equipment. It might be medications. It might be a policy and procedure that they need to adhere to for this institution. So just in terms of staff retention, that's the one thing that we as healthcare architects can encourage our clients to build into a space. And it doesn't have to be a large or complicated space, but a dedicated space for learning.
And is that message resonating with your clients? I mean, yes, you and I can talk about it all day long here, but at the end of the day, how is the reception of this thesis from your clients?
So it varies. The academic clients relate to it more because they're already in a learning setting. Our larger, not our private clients, but our larger system clients relate to it, but they don't take it literally in terms of each building. They're looking for ways in the community to have a learning space where they can bring people either from the main hospital or the 4 or 5 clinics in the community so they can all come to one space and have an all-day workshop or conference. So it's a mixed bag, to tell you the truth.
And then also, we just kind of highlighted things around the pandemic and what that has meant and how that has really changed a lot of things. We know we look at a lot of people work from home now. How has this also impacted sites of care, where patients go in regards to the new ways of thinking about the built design, and how has HED responded to that?
Okay, so Mike, you're talking about the new hybrid world that every industry is living in, not just healthcare. So you may not know this and your audience may not know this, but just looking at a typical hospital, 40% of that space is administrative. So in theory, 40% of that FTE count or that space could be offline. It could be in Vancouver for all we care, right? But the problem is when everyone is remote 24/7, you do lose that face-to-face communication. So our healthcare clients, my colleagues in architecture, we're still struggling how to come together face-to-face, even if it's a brief moment in time. So it's an issue we're still dealing with, to tell you the truth.
And is that a topic that is being brought up by your clients as well? And of course, we may not have answers today, but is this top of mind for them as well?
Well, actually, to tell you the truth, what our clients are relying on is more and more digital tools. And I'll give you an example. When you do an architectural project and the design is done and the builder comes along, everybody, about 20 people, all in hard hats, stand in a room on a wall and they're moving Post-its around. It's called a pool planning session. Well, guess what? Because of COVID and this hybrid work model, we're now all doing this on Zoom or WebEx or whatever the platform is with digital tools that are either called Miro or Concept Board or vPlanner. So our clients are relying more and more on the digital tools, which is exacerbating this need, and it's relinquishing us of the pressure that we do need to come together face to face. So it's still a work in progress.
It certainly is. And I think the solutions around it may not be come to bear for quite some time, because I still think we're going to be seeing this evolution of what this might be. We might see it boomerang back a bit, because I think you're absolutely spot on, Sharon. I think people are recognizing that loss of connectivity and those spontaneous moments of innovation and opportunity for that collaboration when you're not in person. So I think we're going to continue to see the turns on this and discovering what is the balance between this hybrid model and in person. I think it's still very much a work in progress. Sharon, let's also talk about something that we've seen big trend lines in healthcare. This notion of, think of outpatient facilities, think of surgery centers, think of these facilities. And because of the, new technological advances in surgical practice, surgical devices, technologies, or otherwise, whether it be non-invasive or less invasive procedures than they used to be, we can now start having these types of procedures in these outpatient settings, which as well as I do, that it can create optimal performance and increase revenue generation. How big of an impact has some of these advances in technology, science, and procedures then influence the build of these types of new outpatient facilities? Again, less expensive, can be more optimized, create increases of revenue generation. How big of a part of that portfolio and what you guys are working on today, how much has that been impacting what you're seeing within HED?
Well, if you look at the history of healthcare architecture, the change from inpatient to outpatient began in the 1980s with the implementation of DRGs. So the outpatient setting is still your lowest expense setting compared to the inpatient. But I will say some of our clients prior to COVID started investing in their outpatient settings with more technology and more innovation. And I'll give you one example. Stanford in particular, about 18 months before COVID arrived, began the process of not having a waiting room and not having a reception in outpatient. So there was the kiosk like we now see everywhere in airports. After COVID, all of our clients are now trying it, but they're still in that nascent setting. What Stanford through the pre-COVID to post-COVID has discovered that even though you've got a kiosk and no particular waiting room, you still need someone greeting them and smiling at them and saying welcome. That's just good practice. And Stanford also discovered that this person is not that traditional receptionist taking your insurance information or questioning you about your next schedule. That person that is greeting you is more of a concierge. How can I help you today? How are you doing? Is there some information that I can share with you? So we're hopeful that our clients who are now just beginning that phase in the outpatient setting are going to be able to learn from the Stanfords of the world and start utilizing that model.
It's very exciting. And it's also just, being able to answer what the market wants, right? This is, I think, that need to be able to create that personalized care and have that patient feel, as you mentioned, welcomed when they arrive at a facility. That's part of the consumer experience, if you will. So
Yeah.
Absolutely love hearing and seeing that and recognizing that others are starting to bring that into their facilities as well. Now, Sharon, let's take the proverbial crystal ball off the shelf a bit. Let's look at a little bit future state as well. Again, things have been changing rapidly over the past few years and will continue to do so moving forward. From your perspective as an expertise in this space, kind of on a macro with our listening community, what should they be mindful of? What are you seeing that we should be thinking about as we plan for the future? And then, of course, where is HED going to be in the future as well?
So not just healthcare, but on November 22nd or whatever that day was in 2023 when ChatGPT came out. So healthcare and healthcare architecture will be driven more and more by data than we realize. If you just think about that cool little tool that turns the light on and off when you walk in and out of a room, that motion sensor for light, well, guess what? that motion sensor is now collecting data. It's doing a lot more than just turning on and off the light. That information can tell a healthcare provider, oh, how many people are in this room? How active are they in the room? So therefore, it's the mood of the room. Do we really need a room this size for 4 hours a day, or is it 1 hour a day? Do you see all the information that can come by just this one data point? So now imagine data points not only on light and activity, sound, temperature, everything you can imagine. And the larger healthcare systems have the capacity to track this data and then turn to the architect or a provider and say, you say you need this, but here's what the data proves. Now, what we're looking at as healthcare architects is just like ChatGPT. Sometimes that data is wrong or it doesn't have that human context. So that's where HED is rising in terms of healthcare architecture, thought leadership. And we derive that leadership based on all of the lessons learned from the past 30 or 50 years of working with different clients and how they operate their healthcare delivery.
What an exciting future. And it is really is already, here in front of us, Sharon. You see the connected hospital. You see all of these Internet of Things types of devices that you just mentioned, but I never really gave it the thought of being able to influence and impact the built and the design of a facility. That is absolutely fascinating, an exciting future indeed. Sharon, let's bring it back to current state as well. What's one problem, need, or question that you have that our community can be helping you and the HED team with?
Oh my goodness. So I don't know if you know the phrase POE. It stands for post-occupancy evaluation. So now, Mike, imagine you're an architect and you've spent 5 years from programming to designing to building. And now this clinic or whatever it is has been open for maybe 18 months, maybe 2 years. I want so bad, either myself or a neutral architect, to walk through that entire building and talk to the hands-on caregivers and talk to the patients and families. And I want to know what's working, what's not working, what could we do differently. That is so hard to come by, a post-occupancy evaluation. It does take time. Sometimes it takes hours and days, if not weeks, depending on the size of the facility. But it gives us those lessons learned so that when AI comes along and there's this raw data, we can now challenge the data or confirm the data based on true working day-to-day models in a healthcare setting.
Well, in order for our community to collaborate with you on those very, very important ideas, and I love this notion of taking the actual raw data and applying a little bit of human context to it. Very, very fascinating. How can our community engage with you to do exactly that, to have these conversations, to engage in this collaboration? How do they get a hold of you? Social media handles, websites, or otherwise? How do they track you down online, Sharon?
So Harley Ellis Devereaux is the 3-letter acronym HED.design. And I'm easy to come by on LinkedIn.
Easy enough. And those contact points are in the episode notes for our listening community. Just simply scroll on down into your favorite podcast player, find those contact points in the episode notes, or you can head over to our free global online community at passionatepioneers.com. There will be a post for this episode where you can also leave comments and feedback for Sharon and the team, as well as find those contact points online. Again, over at passionatepioneers.com. Sharon, a fascinating conversation, an exciting one, and an area that is continuing to find change and evolution and revolution. It's an exciting time, and it's so grateful to be able to spend time to learn from you and to hear where things are also heading. But before we let you go here today from this podcast episode, we do have one more piece for you. It's a fill in the blank. I'm a passionate pioneer because
Lagniappe. That is a Cajun word for going beyond. It's giving a little extra. Next time you're in New Orleans and you ask for a dozen donuts, they'll give you a 13th. That 13th donut is a lagniappe. When clients ask me to achieve something, I like to go beyond just what they've asked for, give them something a little extra. That's a lagniappe.
Absolutely love it. And I will be in New Orleans shortly, so in a few weeks, so I will have to do that myself as well. So thank you for closing us out with such a great word of advice. Sharon, thank you so much for taking time to be with our community today, to share everything happening in the HED camp and where things are heading as well. But for now, again, Sharon, thank you for being with us today.
Thank you.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.